The ulnar collateral ligament, or UCL, is one of the key stabilizing ligaments at the middle joint of the thumb, called the MCP joint. UCL injuries occur when the thumb is pulled forcefully back, away from the fingers. This is common with skiing and is sometimes called skier's thumb. UCL injuries also occur in ball sports, contact sports, cycling, or just from a simple fall at home. Diagnosis of a thumb UCL injury should be done by a doctor or physio. They may send you for an X-ray and perform some tests on your thumb. Depending on the severity of the injury, you may be referred for an X-ray to check for a fracture. Sometimes a small fragment of bone is pulled off by the ligament. If there is an injury to the UCL, it will be point tender to pressure directly over the ligament. Always test the uninjured thumb first to see how much movement is normal for this patient. Stabilize the base of the thumb with one hand. Then apply tension to the ligament with the other hand. Like this. Repeat for the injured thumb. Apply tension gently as it might be very painful. With this patient, the difference was very obvious. There was significantly more range of motion with no pain. It may be helpful to measure the degree of radial deviation allowed by the ulnar collateral ligament. Hold the proximal arm of the goniometer along the midline of the metacarpal. Hold the distal arm of the goniometer along the midline of the proximal phalanx. Move through full available range, keeping the axis of motion over the MCP joint. Ligament injuries, also called sprains, can range from very minor to very severe. Grade 1 or 2 sprains will usually have some pain, some swelling and bruising, and some focal tenderness on palpation. Stress testing for grade 1 or 2 sprains will usually be painful, but the angle will be no more than 15 degrees greater than on the uninjured thumb. Grade 3 sprains are sometimes called ligament ruptures. There will usually be significant bruising, swelling, and tenderness around the UCL area. If there is a grade 3 sprain, stress testing will show more than 15 degrees of excess movement compared to the uninjured thumb. These injuries are often less painful than grade 1 or 2 sprains. Stable injuries, including grade 1 or 2 thumb sprains and small avulsion fractures, can be treated with protective splinting and rehabilitation. Ask your local physio for help. Unstable injuries, including grade 3 sprains and larger fractures, may need surgery to achieve a good outcome. Referral to a hand surgeon is recommended. For example, the patient shown in this video had no fracture on X-ray, but clear instability on stress testing. He had his UCL surgically repaired a few days after the video, and made an excellent recovery.